Okay, hello, welcome everyone. So we are now at episode 10 of Awesome Careers Podcast. Welcome. My name is Eva Lee, and I'm the founder and owner of our podcast here today. And I want to thank you all so much for joining me today, whether you're live with us here or catching us on the replay. Really appreciate that. The Awesome Careers Podcast is a podcast dedicated to featuring folks in different careers, having them share, different professionals share their experiences, knowledge, what they love, what they find challenging. And I'm really excited to share with you today an old friend of mine who I've known for years as well. With me is, in a bit, I'll have him join us, is Dr. Vang Kou Khang. He is an internal medicine hospitalist. And he's going to share about his experience and how he developed a career path to go into medicine. Dr. Vang Kou Khang grew up in family of farmers in the Central Valley. And it was through his physical labor in the tomato fields and seeing the hardships that his parents had to overcome as immigrants that motivated him to pursue higher education. During his time at Stanford University, Vang Kou's knacks for the sciences and his passion to serve others led him to the field of medicine. And today he is a hospitalist and frontline worker during the COVID pandemic. So we'll have Vang Kou join us today. If you are catching us on the live or on the replay, comment and chat. Let us know where you're watching from. And I just wanted to quickly do a shout out. I see Belle's here. Thank you, Belle, for joining. Really appreciate that. And I'd love to hear where part of the country you're streaming in from. Really appreciate that. So without further ado, let's bring in Dr. Vang Kou Khang. Hey, Vang Kou, how are you doing?
Hey, I'm doing great. Thanks for having me. I think what you're doing here is great, and so I'm really honored to be a part of it.
Thank you so much for tuning in. And what is it? There's a lot of good questions that we typically go over, and we'll get to as much as we can, but I just want to remind folks this is about an hour long. So if you have questions for Dr. Khang, feel free to put them in chat in the comments section. We may not get to it, but hopefully we'll have some time at the end to answer any questions that y'all may have as well. So without further ado, let's jump right into it. Dr. Khang, can you tell us a little bit more about how did you become interested in this field of medicine, right? And just give us a little bit, in a bit we'll talk about responsibility, but walk us through a little bit about how did you become interested? How did you know this is what you wanted to do?
I think the question of how I knew it's harder to address. I initially thought I was interested in medicine, and you and I were in high school when we were part of the Doctors Academy.
Oh, I wasn't part of the Doctors Academy.
No, from high school when I was a part of the Doctors Academy.
Oh, when you were part of it, yeah.
Yeah, and early on I thought, oh, medicine for sure. And then I got involved in politics, and I thought, okay, maybe law. And so when I was at Stanford, I did political science as a major. And then during my college years, I started to, again, volunteer in the clinics. And it was my interactions and my care of the patients that really kind of solidify the epiphany that medicine is my true calling, and I really should gear my my classes and my preparation towards medical school. And so I think that a lot of times you go through this rebellious stage. You know, I knew medicine, but I wanted to make sure it was not medicine, and then came back full around to doing medicine.
That's great. Now, tell us a little bit more about what you do in your role as an internal. I just want to make sure I get the title right, because I think many people may not realize what the title is. But Internal Medicine Hospitalist, which is probably very different from what we commonly know as a doctor.
Yeah.
Right? So tell us a little bit more about your main responsibilities here that you do.
A hospitalist is under the group of hospital medicine. It's actually relatively new. It was like first coined in 1996, but it really didn't start to become popular until like 2006 and so forth. So a hospitalist, as the name kind of implies, my primary job is to take care of patients when they are in the hospital, not so much in an outpatient setting. So when they are in the hospital, you know, I do everything from giving IV antibiotics, giving fluids, taking care of their stroke, taking care of their heart attack, coordinating procedures if they need procedures, and making sure that when they are in the hospital, they get care that is appropriate, that's timely, and that's affordable for the patients.
Great. And so as a follow-up, I'm wondering really quick, Going back to the education, we're going to talk about that in a little bit more. What would you say, how long did it take you from high school? Well, we won't count high school. So from day one of college to getting your doctoral degree, how long would you say that took you?
Oh God, I feel like I was a student for most of my life. Uh, if you go
Hmm.
straight from high school, it's 11 years. So
Hmm.
it's 4 years of an undergrad,
Hmm.
and then it's 4 years of medical school, and then
Hmm.
it's 3 years of a residency. And this is just for a hospitalist. If you wanted to do surgery, neurosurgery, cardiology, pulmonology, it's a little bit longer. But for my specific profession, if you went straight, it's 11 years. I took a couple more years than 11.
Yes, which I was going to say, most people might not realize it, but you actually have an MBA. So
Right.
can you
Right.
tell us a little bit more about what an MBA does and why did you decide to pick that up along the way?
Right. So, as I was in medical school and I was trying to help patients, I was coming to the realization that medicine was more than just providing direct care to the patient. A lot of times there are a lot of inefficiencies, and always ends up costing the patients more when it comes to healthcare. And I wanted to understand the intricacies in the business model, and ultimately how to reduce waste and how to improve patient access, patient care, and costs. And I realized that I didn't have the knowledge to learn the system and then also be able to provide solutions to fix the healthcare system. And so
Mhm.
in between medical school, my third and fourth year, I took 2 years off, and I did an MBA that specialized in healthcare administration.
So I would say, so you would say, like, for example, the MBA was more like an optional career path that you picked up along the way. Do most the doctors that you know and see, do they do that too? Is that a trend that's growing, or is that something that was uniquely you picked up on your own?
It is actually a trend that's growing. I think that the more doctors are in the front lines and they're working, and there's a lot of things that they feel they want to fix, not
Mm-hmm.
just taking care of the patient's disease, but a systemic issue that
Mm-hmm.
we want to fix, that we just don't have the training or experience to be able to be an impactful force. And so more and more, um, there are more doctors who are doing MBAs or even Masters of Public Health, Masters of Public
Right.
Administration, hospital administration. They're doing different masters to kind of gain an extra set of skills so that we can do more than just take care of patients. We can actually implement on larger scale changes.
Absolutely. And I think that's fantastic because we know that the profession and every profession right now is changing. It's not from what we initially studied or learned when we were back in the day, whether it be college or in high school. Um, the career is changing, it's evolving, and I think that makes you really unique to be a doctor who actually has an MBA, who has the business administrative approach and solving, like you're saying, the solution, the cost from beginning when the patient walks in to when they're leaving their health. So I think that's really fantastic. I know that we have some folks here joining with us. Thank you so much for joining, folks. Really appreciate that. Oh, your auntie's
Oh, hey
here.
guys,
Thank you guys
Monty, hey
so much.
Joan,
Thank you all.
hey Chris, hey
Wonderful.
guys,
So
hey
excited.
Mal.
I love that. Okay, now we're jumping into something a little bit to help us get an idea. What's your schedule like? What's a typical day or a week like for you
Mm.
as a doctor working in the hospital?
The hospitalist lifestyle, it's usually 1 week on and 1 week off. Um, so when I'm on, I do 11 to 12-hour shifts. So
Wow.
on a typical day, I get into the hospital at 7. For the first hour, I round on my patients on the computer. I look at the things that happened overnight,
Mhm.
the morning labs that were drawn, making sure that orders were given or done, and then from like 8 to 10, I actually round on the patients at bedside. I go and I talk to the patients. I ask them how they're doing. I explain to them kind of the plan for the day so they know what their hospitalization course is, and then I touch base with the nurses to make sure they know what the plan is, so everybody's on the same page. And then from like 10 to 12, I oftentimes talk to consults. A lot of times someone comes in with a heart attack and you need to talk to cardiology, or someone
Mhm.
comes in and they're bleeding and you need to talk to the gastroenterologist to come in to stop the bleed. Um, and then in the afternoons, it's mostly writing notes, calling families to update them, It's important, especially during times of COVID where they're actually not allowed to come to the hospital.
Right.
It's really important for us to call families who are worried at home, and I think that every one of them are very appreciative of the time we spend on the phone calling them, updating them, making sure they know what the plan is. And then I do 1 or 2 admissions in the afternoon, and I go home at around 6 or 7 p.m. depending on the day of the week, and
So
then I
that's a
do it over
whole,
again.
yeah, so I was gonna say that's
That's
a whole
yeah,
12-hour cycle.
correct,
And so you do it for a week straight and then you have a week off.
correct.
Okay.
That's the traditional structure of a hospitalist. In my hospital, it's a little bit different, but generally that's what happens. You do 1 week of inpatient work, and then the other week you're off. You can pick extra shifts. You can do leadership stuff. You can do research. You can do anything really, but it's 1 week on, 1 week off.
And would you say like was this what you envisioned when you were a student learning about medicine, that, this is going to be sort of like the this typical week structure like?
No, when I was actually in medical school, like I said, the medical field of hospitalist is relatively new, and it wasn't as advertised, and I wasn't really. I didn't actually have much information or knowledge about it. And then as I was in medical school and I was having preceptors who were kind of walking me through what they do, one of them was a hospitalist, and he said, "Oh, you don't know what a hospitalist is? Let me show you what it is." And me being able to see what he does, the impact he's able to have on patient care, costs and efficiency, and his ability to still enjoy his life and have a family and travel and do the stuff, that was really, really appealing to me as a medical student. And I knew at that point, in addition to my MBA, that this is kind of the profession I wanted to pursue, and not anything else.
That's really great. That's awesome. I'm glad that you found a resource there and a tool there that further help you explore that. Now,
Right.
Jumping in really quick, how would you say your undergraduate degree? Give us a little bit more about where you study, or what did you do? What major did you study as an undergrad? And then how did you choose what grad or what medical school to go to?
I was a political science major, so maybe you can deduct whether or not that was useful to my medical school. But I did decide as a junior that medicine was it. So I did loop back around, and I did get a double major. So I did get a major in political science and a major in biological science. But I would say that even in medicine, your major doesn't matter as much. There are some prerequisites that you have to take regardless of what major you are, but there are prerequisites that you have to take, and then those are what determines your application and your GPA when they calculate it for medical school. When it came to choosing medical school, I think the location was really, really important to me. I was in that age range where I wanted to be away from home, but not too far away from home, so that I could travel back on the weekends. And UCLA being only 3.5 hours away from Fresno made a lot of sense. I actually fell in love with the University of Minnesota, Twin City. I almost went there, and again, the deciding factor for me was that LA allowed me to visit on weekends and then be away from family on non-weekends as well.
It's probably save you a lot on the flying cost too, right?
Yeah, for sure.
Yes. Okay. Now, how would you say do most people get involved in this field? And I know that they probably won't right away, so we probably won't be talking about the folks in med school because you probably have more exposure to that. But what about folks who are currently still pursuing their degree? What would you say the early experiences and exposures would be helpful to help them make a deciding decision later on about whether or not med school or medicine is going to be a fit for them?
Right. So even for me, I would say immerse yourself in the field that you're interested in, regardless of what that is. If you want to be a mechanic, immerse yourself into like a preceptor role with the mechanic. In my case, when I immersed myself in a clinical setting and I was working with patients, talking to them, and even though I didn't have any medical knowledge, I felt like I was making a difference. And my presence in the facility of the hospital, in a clinic, that's what really got me into the field and got me in terms of motivated to continue to pursue those 11 years of education.
Great. So now we go back into the doctor. What would you say that, as a doctor, what do you do? What are and I know you mentioned the responsibilities earlier, but what are the essential skills? So the skills and abilities and personal attributes that are essential to success in your work. So for example, when you mentioned
Yeah.
going in the first thing in the morning, looking at all the reports that happen overnight with your patients, what's that skill set that you're actually demonstrating when you are assessing, right? So assessing is a skill set, right?
Right.
What would you say is what are some of the major skill set you use in your work?
So the three I could think about, one which you just talked about is multitasking. So my patient list can be anywhere from 10 to 17 patients, right? And so the ability to keep track of 17 patients, what each one has, where they came from, what the plan is for them, that requires a lot of practice, and it only gets better with practice. The best way to keep track of multitask is to literally have a system where you don't miss anything, because when you do miss something, that's one biggie that should not happen. The second thing would be problem solving. And I think that applies to anything else too, but especially with medicine, when a patient comes into the hospital with abdominal pain, you're literally trying to be a detective. Okay, what are the things that you have? What do I know? What do I need to know to find out what you have? And then ultimately to solve the issue or the question of what is causing your abdominal pain. And I practice that on a regular every day. Again, it only gets better the more you practice. Of course, having a diverse and a up-to-date background on medical the pathology and treatment is important, but the ability to gather evidence and information to come to that conclusion is really important. And the last set of skills, which I think sometimes is underappreciated, is communication. And I specifically communication with the patient. I even though I always try to pay attention to how I say things, I always have to think twice. What is the best way to communicate the plan with the patient so that they understand? Obviously, I understand because I made it, and other colleagues understand because we're speaking the same language. But the most important person to communicate with is the patient and the patient's family. And with every patient, it's actually slightly different. So that's a skill I know that I'm constantly improving, and it's communication with the patients and family.
That's really good. So again, as a recap, assessing, problem solving, and communicating are the essential skill set that you utilize in your profession each day.
Yeah,
Awesome.
multitasking as well.
Multitasking, yes, absolutely. Great. Okay, now let's get down to the really not so fun part, which is what do you like least about your work? What do you dread, or you're like, oh, I have to do this. I don't want to do it, but I'm gonna have to do it. I might as well do it.
Maybe it's early in my career, but there's nothing that I dislike about it. I think that instead of things that I like the least, there's a lot of frustrations I have about medicine, and those frustration kind of stems from the fact that we're just not good enough to prevent diseases from progressing to the state where the patient does need to be hospitalized to receive proper care. And it's a lot of frustration because we actually have good medicine, and we actually have good understanding of how diseases work and how to prevent them, but our implementation of prevention has not been up to par. And we have these patients who have diabetes, end-stage kidney failure because of hypertension, strokes, heart attacks, and I feel like a lot of times they can be prevented. So for me, it's just frustrations with medicine, and I hold us as doctors more accountable than the patients, because we need to find a better way of teaching and preventing these kind of preventable diseases from progressing to their end stages.
Right. And that's so important. So yes, absolutely. Yeah. Okay, now what about the fun part? What do you enjoy about your work? What are you
Oh God.
oh, I love this about my job.
Oh, I love everything about it, really. Probably the thing that I love the most is that I feel like I can make a difference in someone else's life, literally. They come in sick, and I can give them antibiotics and they get better. They come in with a stroke, and I treat their stroke, I rehabilitate them, they're walking again, and I feel so much better. And I would say that even when I can't save a life, or even when I can't cure cancer, there's still things that I feel we can do, offering them comfort, offering them their dignity that they want. And these small things, even though it doesn't sound like a big thing, they make all my 11 and 12-hour shifts very, very worth the daily commitments that I bring to the table. I also like my job because it's very challenging. Every day, every patient is slightly different from the rest. And I'm always learning more about each pathology. I'm always learning more about how to better treat a pathology that this patient had that the other patient didn't. And I feel like it's always continuously changing. And the last thing I like about it, which we kind of already alluded to it, is the lifestyle. The fact that, you do 1 week on, and then you get 1 week off to much focus on yourself, your family, travel, do whatever it is that you want. And for me, that's mostly been like research, community service, fishing, and family.
That's wonderful. And we'll come back to that. We'll come back to that about, like how do you take care of yourself? But absolutely, I think that what makes it, I think that what you mentioned, like, what you love about it is that it gives you that flexibility.
Right.
Okay. So we talked about the education required in training. Can you tell us about, in terms of like training, what was med school like? What do you do when you're a med student? How is that different from what you do now as a professional? Can you give us a little bit light about what that's like in med school?
Yeah. So the worst part of training to become a hospitalist or any doctor is med school. That's the worst 4 years of the 11 years. It is because, most of your time is spent in front of a book, in the library late at night. And all you do is you study, and sometimes you forget, wait, why am I studying, right? And it really does take a step back from the book to say, okay, after 4 years of medical school, I get to work with patients. I get to make the life changes that I know I will at the end of this. And med school, like I said, it was the worst part of the 11 years. A lot of it was not with patient contact, a lot of cramming, a lot of studying. And I promise you, if you make it through the first 4 years, the next 7 years is a piece of cake.
So would you say that's different from residency, right? So how is that now different from residency? Med school is all more like the rigorous, the discipline, the academia. What is residency like?
Residency was demanding too. Lots of hours you have to put into actual patient care. But I think the difference is that, when you're a resident, you actually get to work with patients. So those 11, 12 hours you actually spend technically studying, you're actually working with patients. So the time commitment is not bad. You can actually see the fruits of your labor. You can actually be reminded every time you're with the patient, I'm doing this because of this patient. I'm doing this because I can make a difference. And that's different from medical school where you don't have that much patient interaction. And a lot of times it's just yourself behind a desk in a dark room.
So many days studying, many days, right?
Right.
The grind is real.
It was a lot of grinding, yeah.
Okay, so what about, really quick, now as a practitioner, right, what kinds of challenges do you face when your line of work right now and during the pandemic? It's pretty, what did you say, like what are you experiencing now? Is it any different pre-pandemic?
Yeah, definitely the volume. Well, as we speak of this week on, I guess, February 24th, actually the COVID numbers have calmed down, which is phenomenal. Vaccination is working, social distancing is working, and the COVID numbers are coming down. But I do remember a time not so long ago where COVID numbers were 80% of the patients I saw. 90% of the patients I saw. We were double booking rooms that were meant for one patient only because we didn't have any other space for it. Some patients, we were using our computer space as patient rooms because there were just patients everywhere. And I think that for me, this is my first year on as a hospitalist too. That's been the biggest challenge in my line of work. And the other thing too is some of these patients, there's just not a lot we can offer because the medicine is not good enough. We don't know enough. We don't have enough to offer them. And I find myself always trying to celebrate the little small victories, the little small progresses that we make with the patients, because it's all we have to celebrate. And so, COVID sucks, and we're learning from it, and we're hoping that we can actually get over it pretty soon.
Right. And I know that you also are, you take the vaccine as well. I
Correct.
believe there were many people were sharing about their experiences of taking the vaccine. Can you give us a little light about that? What's the symptoms like? Or, is it bad? Is it, is it simple like getting the flu shot?
It's a little bit worse than the flu shot, but definitely worth it, right?
Definitely
It's
worth
it's both it's both safe and efficacious too. And so as soon as your different communities
it. Mhm.
allow you to get it, my personal recommendation is to get it. That's the only way we can achieve herd immunity. The most common side effect is pain at the site of
Mhm.
injection. A couple people, my colleagues, they have like a little bit of fevers, chills, and fatigue and body ache, but nothing that a Tylenol couldn't fix or a couple hours in bed couldn't fix, and then it gets better.
Right. I know. I'm among the many people waiting for the vaccine as well. So I'm very excited. And there's really good positive things I'm hearing from, the CDC about, the vaccines that they're distributing. I think Johnson Johnson's also releasing theirs as well. So it makes it
Correct.
very promising, knowing that, there's more vaccines on the way. So
Correct.
hang tight, folks. All right. So I know we're halfway through. And I know there's a few, I'm going to take a pause here and quickly acknowledge some folks here. So yes, Aunt Molly says, you're a true hero, Dr. King. Absolutely. Oh, and she took her Moderna vaccine. Awesome.
Oh,
Great. We
excellent.
have, Gloria coming in from watching from Turlock. Thank you, Gloria, for tuning in. Appreciate it. We
Hey,
have
Gloria.
Jai tuning in from Reno, Nevada. Wonderful. Thank y'all
Jai was my
so
roommate.
much. Oh, that's awesome. I'm great. I'm really excited about that. Thank you folks for tuning in. And again, if you have questions for Dr. Kang, feel free to pop them in chat as well. We'll try to get through as much. There's a good handful more questions on the way. Okay. So what are, I would say, the next part here is like, what other related career fields did you also perhaps, or should people consider also if you weren't pursuing a hospitalist, what would you have gone? What career, what direct role or career would you have been decide, or would you have decided?
So can I still do medicine?
Yes. I mean, it's
Okay.
totally up to you, but
Okay.
on the line of
Okay.
medicine.
Because if I can't do medicine, the answer is a little bit different. But if I can still do medicine, uh, I would still definitely prefer medicine because I actually love medicine, and
Mhm.
the kind of care that I like to provide is like medical care. I don't think that you have to be a hospitalist to provide care to patients. Nurse practitioners, physician assistants, and even registered nurses, they all are actually, if not more important myself, very important to being able to provide care. And I don't think that a doctor is the right choice for everyone. Again, it's 11 years of education. It's $400,000 in debt, right? That might not be the right answer for everyone. If you become a nurse practitioner, a physician assistant, or an RN, less time, and you're still able to provide phenomenal care to patients. You're still able to make a huge difference in their life. And so look into other things as well. But if you are interested in being a doctor, also know that there's more than one way to become a doctor, and we'll talk about that later as
Yeah.
well. Yeah.
So that's great. Thank you for shining some light about like the other potential career path, like whether it be nurse practitioner, registered nurse, providing direct care, right? Providing direct care in the community is also, there are many other occupations that also do similar type of work. I recall when I see students who are coming in and they say, I want to become a doctor, which is really
Right.
great and exciting. And then, sometimes they may not realize that when you are a doctor and whether you're in the hospital or you're in the clinic, right, you are essentially working with sick people. The
Mm-hmm.
people you're seeing for the most part are not going to be healthy people. They're probably sick. They're probably, like you mentioned, like I think one of the frustrations you mentioned, like, who are much further along in diagnosis, right? Where it's like, oh, we could have prevented this 6 months ago or maybe a year ago in medicine. And yet this patient's coming in with X, Y, and Z that's at this stage now that it's beyond our control. And I don't think most people realize that, you're not, like I was saying, do you enjoy, for example, not enjoy, but like, can you stand seeing blood? Can you stand someone who's sick, vomiting right there on the floor, coughing? And for many people, they not realize that's what doctors do. You do have to be exposed to that. And I'm curious for your experience, was that something that did that thought ever come to your conclusion when you were thinking about practicing medicines that you're going to be seeing people who are sick?
Not to the degree that you mentioned, but I've actually seen all of it.
That's a bit, that's
But
a
when I,
bit detailed,
right, right, when I'm
hypothetically.
studying behind the books, I don't expect to see an eye popped out of the socket or a bone poking out of the arm, but I've seen it all. And you're right,
Mhm.
you do have to have some kind of stomach for it too, because
Right.
in those moments, time is of essence of importance, and knowing how to help the patient immediately actually will determine if they survive or not. And so, um, yes, I think that you should have a stomach to be able to see all that. And yes, from time to time, you will see things like that, and you just need to know how to save the patient or get them to the person who can save them, and move on.
Right, wonderful. And I know that we have some more folks tuning
Hey,
in.
Macy.
Jason sings, so proud of you. Absolute. Macy's tuning in from Minnesota. Thank you, Macy. Dr. King is the best. Absolutely. One of our own in the Central Valley, making it out of, into the pipeline. And I'm just so excited as well. So let's go back a little bit more here about what kinds of accomplishments, tend to be value in your work. For example, how do you measure success?
Mm.
How do you get rewarded in this field? So for example, is it like, okay, my patient came in and then went back home better than when they came? Is that success? Or
Yeah.
my patient's cure, is that success? Or we're not able to save the patient, and but we provided them, like you mentioned, like put them in a better comfort level. Is that success? Tell us a little bit more about, like, as a practitioner in this field, what do you consider to be accomplishments?
So personally, I guess what I perceive to be accomplishments is different from what the hospital perceives to be accomplishments. The hospital looks at um, readmission rate. What is the percentage of patients who get discharged who get readmitted for the same reason? They look at once they're in a possession or in the hospital, what kind of preventive things do we do? Do we get them vaccinations, flu shots, and so forth? But personally, the things I value is what you mentioned. Like when a patient comes to me, they're in the most vulnerable state. They're sick, they're ill, they're in need of help. And my goal is literally to be able to help them not only with the disease, but to be also able to address anything that brought them in, all the risk factors that led to their presentation, their social support. Do they have good social support? If they don't, I will always connect them with like caregiver services, assisted living facilities, and so forth. What is their social economic level? Is it because that they couldn't afford the medication? And if that's the case, we have like medical financial assistance or Medi-Cal, Medicare that we actually help a patients apply for. Or is it that they just don't have health literacy, and then therefore I start the process of teaching patients about their disease process, how to treat it, how to prevent it from getting worse, and then I also connect them with outpatient services to continue this education, just to reinforce healthy behavior and so forth. And so that's usually how I measure my own success, is that I make sure I not only treat the disease that brought them in, but everything else that contributed to them coming to the hospital, and making sure that when they go home, it's a safe disposition, they're well taken care of, and
Mm-hmm.
hopefully they don't come back. They don't need to come back.
Right. I think that's really good in terms of, like, like saying, like you were saying, measuring your own success, right? With the
Right.
seeing where the patients at those small stages where, like, they're like, their support system. That's really good.
Right.
Wonderful. Okay. Now, tell us a little bit more about what are some of the most effective strategies for seeking a position in this field? And you mentioned, like, a hospitalist is still considered very new compared to the, typical roles. What would you say, like, is the most effective? So people start working obviously right now it's a little harder because of the pandemic and trying to get experience inside the hospital. Assuming that, let's say in the future, once everything's back to some new normalcy of, like, going back into the hospital, getting work experience and lab experiences, right? What would be other places or other pinpoints of areas that you would say that are effective to getting experience?
Well, I guess it kind of depends on where you are in your life. If you are a high school student and you're even thinking about medicine, I kind of go back to my advice earlier, and that is to immerse yourself
Mm-hmm.
into the hospital setting, immerse yourself into the role of whatever it is you want to be, a cardiologist, a lung doctor, or a hospitalist in my case, and see if you can see yourself doing this job. If you are at the level of a medical student, kind of the same thing. Find a preceptor who is in the field that you're interested in, and you start to ask the deeper questions of how many years does this take? What is the time that you have left to spend with your family or to pursue other interests? If you are a resident, and the resident is basically the final stage of training before you become a hospitalist, my advice is actually to consider doing residency at the place where you think you want to work at.
Ah,
Yes. So when you are a resident at the place that you think you want to work at, you have 3 years to demonstrate how much of an asset you can be to that organization, such that when there is a job opportunity, they already know, oh, this person is good, or hopefully this person is not good, and they would consider you for a job, right? I was very blessed. During the pandemic, a lot of the hiring was frozen. Money was
right.
just frozen because people couldn't afford health insurance, and so all the hospitals were losing money, and hiring was frozen. But I
Yeah.
was very blessed because I did residency at the same place that I wanted a job, and they knew me for 3 years, and they knew that I have stuff to offer, and so they made an exception to hire me on
Mhm.
uh, as a hospitalist. And again, that's all blessings altogether too. But if you have an idea where you want to work, considering a residency or getting your name into the application pool in other ways is probably the best way to seek a position in this field.
Great, that's wonderful. And yes, like you were saying, across the hiring freeze was across all industries right at the beginning
Right.
of the pandemic, and the good thing is that right now we're seeing more hiring coming back. We know that companies, organizations across all industries will be hiring again, and so which is great news coming up for many people who are, if you were laid off or experienced some hardship, or you were one of the potentials and you were just sort of on pause. And I think your advice there about, like, for example, start thinking about where you want to do residency, which is like any organization, they're training you, they invested in you. Do they really want to go
Right.
back out there and train someone new? No, that's not really their goal, right? And so definitely, I think your tip there was very helpful to help people think a little bit more strategically when you start looking at where they want to do residency. Great. Okay, now here's something there, and I know we slightly alluded to this earlier, but how do you stay motivated in your work? I mean, sometimes like you were mentioning, like during the pandemic, it was at one point, so every room, every little space y'all had, you had to give up a bed. People coming in waves of, with COVID infection. How do you take care of yourself? How do you stay motivated?
Yeah. It was hard. It was definitely hard. But I'm kind of like a glass half full kind of guy. And oftentimes I count my blessings. And for a lot of these patients, especially when it was really hard, the only thing that we could do was, again, just take celebrations in the very little progress that we make. And so the families would be updated. We would celebrate that the patient was able to cut down on oxygen requirement. The patient is talking full sentences now, or the patient is, doing better, so and so. And I think that being able to recognize those little small blessings is instrumental to being able to do this for 30 years, right? And in terms of taking care of myself, the job itself allows structure for wellness. And I think that for me, time to myself is important, but also I always try to make time for friends and family and so forth. And my cat, Jerry Katanzri, is on here as well. My auntie, Shaw, is here as well. And a lot of my friends and family are on here. And I think that that's really important to one's wellness and one's ability to continue to come back to work after the week off, and to be at full speed and to be able to take care of all these patients, because they deserve your full attention, your full energy, because you shouldn't come back tired. You should always come back energized and ready to take on the week.
That's so good. Yes, absolutely. Yes. Vang Kou is a great human being who definitely cares for all people. Absolutely. He is. Furthermore, that's so good. I really appreciate that.
I didn't pay for any of these comments, just so you know. I didn't pay for any of these comments.
Jenny, thank you so much for tuning in. Really appreciate that. This is, yes, Grace is not real. Wonderful. Thank you all so much. Appreciate that. Okay, now we're going to get into the sort of, I asked this for all of my guests, and we briefly talked about it earlier as well. As a person of color, as a Hmong, Hmong American, have you experienced challenges in the workplace because of either your race or ethnicity, the language, gender, age, or other barriers? Whether you have, or let's just say if you have not, how would you go approach it? How would you go about it?
Yeah, that's a deep question. I think I've been very fortunate. I personally, I can't think of any challenges as it pertains to my ethnicity, my gender, or my age at work. Actually, like in my hospital, they're pretty progressive. Our chief of medicine is a pretty young female doctor of Chinese descent. And then the area medical director, who's in charge of the whole hospital, he is a male doctor of Asian Indian descent. And so it's pretty diverse. And so ethnicity, gender, and age, I think in the field of medicine, we're doing a pretty good job at breaking it down. And obviously there's still room to progress. I will say that I do know that challenges and barriers to success do exist, and especially in the Hmong community. And this is evident if you start to break down the data on like the model minority stuff. You see that the Hmong community, we have lower rates of proficient literacy. We have lower rates of high school graduates, and even lower rates of advanced degree graduates. And this is kind of innate in the fact that there are lots of barriers, poverty, not enough resources to focus on academics that exists. And that's why, Eva, what you do here with Awesome Careers, this is so important to kind of like chipping away at these barriers and helping us kind of break out of these chains of poverty and being able to like advance our students beyond high school into whatever career and development they want to do. So the barriers exist. I've been fortunate to have not had to face them, and I would love to be a part of any effort that is towards the goal of breaking down those barriers for our Hmong community specifically.
That's great, and I really appreciate that, and thank you. But I'm wondering, for example, like what about situations like, for example, when your patients who are, you have experienced patients who are much older, right? Who's getting advice, or you, the young doctor, coming in writing them a prescription, and they're much older. Do you ever experience those sort of like look in the face where they're like, "You, the doctor?"
Yeah, I mean that happens pretty often. I walk in and they're like, "What? How old are you? 20?" I was like, actually, I'm a little bit older than that. But yeah, that actually. It happens quite often. You're right. When I walk into the room, I have an elderly patient who says, "Well, you're too young to be my doctor. What do you know?" And it doesn't affect my practice of medicine. It just takes a little bit of time for me to reaffirm the patients to really much gain their trust, right? Because I think that's the task at hand is, regardless of how old they are, you should always have a plan to gain their trust. And oftentimes they might have the opinion that you're too young, that you don't know enough. How can you possibly take care of me? And all you really have to do is really find a way to earn their trust so that they will allow you and they will trust you to take care of them. And I don't think that I've ever had a case where I wasn't successful at convincing them that I was legit and that I can take care of them. But yeah, it does happen more often than I can think about. And I only thought about it because you brought it up, because I always like just brush them off. Yeah.
Yeah, because I'm wondering, like, especially when sometimes a lot of in the profession, sometimes, regardless, they may not have the intentions. I don't think that's the goal of any patient is to see and perceive you like this young doctor. But sometimes it might be a little bit surprised that, there's, you look so young, you look like you could be the intern still, right?
Yeah.
And although, again, how do I overcome that? And I think that what you're saying is like, just really educating them and trying to earn their trust so that way they feel confident about the care I'm going to provide for them. And I think that's really important, is it's developing that relationship. And so thank you for sharing that. I really appreciate that.
Yeah.
Okay. Now we're getting down to the fun stuff. If you could do it all over again, would you choose the same career path? If not, what would you change?
I actually would. I've thought about this many times, and I don't think that, other than not procrastinating and missing like scholarship deadlines, I probably wouldn't change anything that I did. I took 3 years off between college and medical school, and I was with Dr. Katanzri doing a charter school, and I learned so much from opening the charter school to being a teacher, and I have so much appreciation for being a teacher. And then I went to medical school. I did a business degree, did residency, and there's nothing I would change again other than missing scholarship deadlines.
And I don't think people realize that, but you can still apply for a scholarship. Even, your people think, oh, it's the only time you can do is like when you're an undergrad, but no, if you can get free money anywhere, you should apply for them.
Correct.
Absolutely.
All the way until even residency, there's always like scholarships that you can apply for.
Great. Yeah. Awesome. Well, I'm glad that, even if you had the magic wand to do it, you would still pursue it. And I think we need more folks like that. That's wonderful.
Correct.
Okay. Can you recommend for folks who are listening in, and whether, again, job seekers or young professionals coming in, or even someone who's in high school watching right now, what are some trade journals or magazines or professional associations which will be helpful for these folks? If they want to learn more, they want to connect with other professionals. Is there like a network that you can share? Mm-hmm.
Right, I'm a little bit biased because I'm a hospitalist. So the journal article, or the article they can often refer to, is just the Hospitalist journal. It's online as well, and the article covers the latest evidence-based medicine to the job prospects, to advancements in like patient care, efficiency, waste reduction, and so forth. And so that's a great article to just kind of read up on as well. And I don't own any shares of this, just for disclosure, but it is a really good article to just read over.
That's good. Thank you so much. And I don't know if folks know, but sometimes for many of these associations, or even some places, if you're a student, it's free, no cost typically, or if not very low cost. So if you are in that status, take advantage of it. Absolutely. Now, going towards the end, we're heading towards the end now. And then folks, if you have questions for Dr. Khang, feel free to pop them in chat. We'll still have some time at the end to answer any questions that folks may have. So what are your advice? What are your two advice that you would give someone who's considering this career? Or not in particular, maybe even this career, who's interested in working in medicine? And besides the part where you mentioned, like, immersing yourself in the experience, but, what's going to be that 1, 2 takeaway points that you hope that they understand?
Can I cheat and give 3?
Yes, you can cheat and get 3. Give 3. Give 3.
So the first one is to make sure that what you're doing is what you love, and if you're good at it, even better, right? But make sure you love it, because regardless if it's only 4 years of training or 11 years of training, it's a lot of training that goes to waste if you don't love it. And then the second advice is that it's actually okay to fail. I'm going to be honest, right? It took me 2 tries to get into medical school. A good percentage, 30+% of people who apply don't get into medical school just because it's so competitive. But that's okay. It's okay to fail the first time, as long as you make it a learning opportunity to be better the second time. And it did take me 2 times to do it. So it's okay. Don't worry about it. Learn from it. Be better. The third advice I would give is that you don't have to reinvent the wheel. Things have been done before you. Other people have traveled the path you've gone. There's no need for you to walk it alone. Seek the advice, the counsel, the mentorship of others who have gone through the path. And you can either choose to go through their path or choose your own, but at least get some advice from them. You're never alone.
That's so good. I really appreciate that. I think your part about, again, like really loving what you do, like truly have a love and passion for it. And like you're saying, the second part is that failure is part of the success. And I don't think a lot of people talk about that. So we're going to spend about a minute just quickly talking about that. And I really appreciate that. And again, seeking mentorship and support, you are not alone. That's so powerful. And I really appreciate and thank you for sharing that part about applying for med school. I don't think people realize that it's not a straight shot, meaning most people probably are not going to get it the first time. Correct. And if you persist, and like you were mentioning that, just learn from it and apply again. Because what's the worst outcome that will happen if you apply again? They just say no.
Right.
So would you say like that was one of the, how was that experience like, when you got that first time experience, like you didn't get this yes right away. What was that experience like? How did you pick yourself back up and say, you go back out there, you apply again? How did you do that?
It was disappointing. I'm not going to lie. Not getting an admission the first year, I worked so hard. I went to Stanford. I was a double major. I worked my butt off, and I didn't get into medical school. And it was a huge disappointment. And I will say that what was very instrumental to me picking myself back up was actually families and friends who actually do believe and continue to believe me and continue to support me in everything that I do. Having them in my corner through the next year when I was learning and being better, that was so instrumental to me just keeping up the fight and trying again the second time. And it doesn't have to be family, but for me, I was just very blessed to have people who would really like would take off their shirt and give it to me, or just be in my corner regardless of what happens. And I think that finding that kind of support system is really, really important.
Yes. Yes, that's very vital. Regardless if it's your first job, your first experience, or down the road 10 years, right? Absolutely. Having great support system. Okay, we're down to the last few folks. And so question is, how are you handling the student loans? When does a doctor typically become debt free?
So I owe $420,000 in debt. Don't worry about it. You'll pay you'll pay it off, right? Money, when it's something that you love, something that you know that you're good at, that you will do. Money doesn't really matter. Just like time, 11 years is nothing compared to the rest of your life. $420,000 in debt is nothing because you're gonna pay it off. And the way that I have established that is it's gonna be 20 years. I pay about 10% of my income every month, maybe a little bit more to try to cut it down. And it doesn't affect your quality of life. It doesn't affect, you don't feel it because you're already doing what you love. The money, you don't see it, it just disappears. In 20 years, you'll pay it off. There's always plans for it. There's always programs for it. And if you commit to underserved communities, God willing, 7 years later, you actually get your loans forgiven for these loan forgiveness programs. So lots of repayment programs out there.
Yes, right? That's really good. And I appreciate that. I think that, those are one of our, our biggest communities that don't get the support. And so being able to invest in them and really seeing some support even in your role and supporting these communities is a great relief. So that's great. Right. Okay. So Annabelle says, mentioned, thanks for the advice. Failure is okay. Thank
Absolutely.
you for sharing that. And again, Dr. King, aside from being California's favorite doctor, who is your favorite superhero and why?
Oh, gosh. I would actually say Batman, even though I have like a Superman cup and I have like a Superman PJ. I would actually say Batman because when you think about it, he, other than being like a playboy, super rich guy, he actually doesn't have any superpower, right? But he uses what he does have, which is his brain. And all the villains he takes down, all the problems that he solved is with what he does have. He doesn't require anything extra on top of that. So Batman is my guy.
So there you go. Dr. King's on the Batman side. Just to let folks know if you didn't realize it, but they're among people in the DC universe back in, if you watch the movie. Okay. So about ask, what kinds of self-discipline did you have in order to stay on track with reaching your goals?
I think for me, it was a little bit easier. I didn't have a family. I didn't have any kids. And so I was allowed to really just focus on my studies. And that really does have to take priorities. I had colleagues who were fathers and mothers, and they were trying to balance being a mom and a dad and study at the same time. And it was hard. But really, at the end of the day, they did prioritize. And you have to prioritize studying for those 4 years. And then after those 4 years, you can actually find a better balance between what your other life demands are and that of a resident and so forth.
Right. That's good. That balance. Yes. Okay, we're coming right here to the last one. I tried to be creative on this question, so I asked, this will be my last question. Maisie says, if you were to be blessed with one superpower, what would it be and why? Dr. King, are you there? I think we have you on pause for a bit. I wasn't sure. I think there's a bit of a lag with Dr. King really quick.
Yes.
He's loading in really quick. There you go. Awesome. So the question was,
What did you
what
hear?
would be? We didn't hear you, unfortunately, because it was a little bit light. You're going to have to repeat it. You're just going to have to repeat it. So if you were blessed with one superpower, what would it be and why?
I would love the power to heal. I don't want anything for myself. I want to be able to just heal people's pain, their suffering, their cancer, their illness, be able to make this world a healthier and happier place for people. So that's what I would want, is the power to heal.
Wonderful. All right, folks, we're right here at the end now. And again, Molly says, thank you so much for the student debt advice. So thank you, folks, so much for tuning in today. Really appreciate that. And again, thank you, Dr. King, for spending an hour with us, sharing with us your experience, your educational plan, the strategies, as well as, what worked, what didn't, the struggles, and giving us a better insight about what it takes to become a hospitalist, right? An internal medicine hospitalist, which is, again, more of a newer type of career that many people may not realize or do if you're thinking about work in medicine. And so we learned so much, and I really appreciate your time and energy. Thank you all so much for tuning in. If you're new, don't forget to also subscribe, hit follow, and like. And we'll catch Dr. King. If folks wanted to know a little bit more about you, how would they connect with you? Where can they
you can
learn more?
And I don't mind giving my email, but you can also connect with me on Facebook, LinkedIn, anywhere. And I would love to be of assistance to you in your career choices and life decisions,
Awesome.
any way that I can. Yeah.
Thank you so much. I really appreciate that. Stay tuned a bit. I'll come back to you in a bit, but really quick, folks, if you're here and you're new, if you haven't hit subscribe or like, please do so. That allows us to continue to do this type of podcast featuring different professionals as well. And for folks, really quick, upcoming, we do have the Revamp Your Resume, which is a virtual workshop. I will be presenting that, giving you a much more in-depth 2-hour workshop about how to really take your resume to the next level. So you can sign up on that as well, including we have upcoming is the Fast Track to Promotion program, currently taking on some folks who are interested in getting promoted. If you want to learn, again, get coached on how are you going to negotiate and develop your skills to be a really strong candidate for future job employment and opportunities. And of course, we have the Reimagine Your Career Summit coming up as well. So if you want to learn more, get some tips and tricks along the way, we're going to have a bunch of fireside chats, networking opportunities, and roundtable discussions. If you're interested in these as well, go ahead and go to the website and you can sign up. There's some really cool free codes I'm giving out for folks too. So if you're interested in that, just direct message me. Let me know that you're here on the live stream, and I will definitely share a code for you to sign up for free. So thank you all so much. I really appreciate everyone's time and energy to connect with me today and learn from Dr. Khang about his experience. Don't forget to like, subscribe, and thank you all so much for joining us today on the live stream. And besides that, have a happy Wednesday, everyone. See you guys on the next one. Bye.